Most people believe they're doing everything right. They book their annual physical. They fast overnight. They roll up their sleeve. They get the same familiar list of results: cholesterol, sugar, blood pressure, maybe vitamin D if they're lucky. The doctor says, "Everything looks fine. See you next year." And that's exactly where the problem starts. Because every year, thousands of people in the US and Canada suffer heart attacks and strokes after being told they were healthy. Not because medicine failed, but because one quiet, inexpensive blood marker was never checked. It's not exotic. It's not experimental. It doesn't require a specialist or a hospital stay. Yet it's missing from most routine checkups covered by insurance plans, Medicare wellness visits, and employer-sponsored physicals. That marker is called homocysteine. If you've never heard of it, you're not alone. Most people haven't, until something goes wrong. Here's why this matters. Heart attacks and strokes don't usually happen overnight. They build silently for years, while cholesterol slowly deposits, while blood vessels stiffen, while inflammation simmers under the surface. Homocysteine plays a direct role in that process. Think of your blood vessels like the inside of a brand new water pipe: smooth, flexible, clean. Now imagine something slowly scratching that pipe from the inside. Not enough to cause pain today, not enough to show up on a basic test, but enough to trigger tiny injuries. That's what elevated homocysteine does. It irritates and damages the inner lining of arteries. Your body tries to repair the damage, inflammation increases, cholesterol sticks more easily, blood clots form faster. And years later, what looked like a sudden heart attack wasn't sudden at all. Here's the uncomfortable truth. Your cholesterol can be normal and your homocysteine dangerously high. That's why relying only on standard checkups gives a false sense of security. In the US and Canada, homocysteine testing is usually not included in routine panels. Not because it isn't important, but because preventive medicine often lags behind research. The test itself is simple: a basic blood draw, no imaging, no radiation, no hospital admission, and yet many people only learn about it after a cardiac event or stroke, when doctors are trying to understand why it happened despite normal labs. So what exactly is homocysteine? In plain English, it's a natural byproduct your body makes when you digest protein. Meat, fish, eggs, dairy, plant protein, all of it. In a healthy system, homocysteine doesn't stick around. Your body converts it into harmless substances using specific B vitamins, mainly B6, B12, and folate. When that system works, levels stay low. But here's where real life comes in. As we age, absorption of B vitamins drops. Certain medications reduce them further. Smoking, stress, alcohol, and inactivity drain them even faster. And for millions of people in North America, there's another factor no one talks about: a common genetic variation, often called MTHFR, that makes processing homocysteine less efficient. You can eat well and still have elevated levels. That's why this isn't about blaming lifestyle. It's about awareness. Research consistently shows that elevated homocysteine is linked to higher risk of heart attack, higher risk of stroke, increased blood clot formation, faster progression of vascular disease. And unlike many risk factors, this one is modifiable. You can test it, you can lower it, you can monitor it, but only if you know it exists. If you live in the US or Canada, and you're over 40, or you have a family history of early heart disease, stroke, or blood clots, this is not an optional marker. It's a missing puzzle piece. And here's the most frustrating part. The people who benefit the most from knowing their homocysteine level are often the ones told they're fine. No symptoms, no pain, no red flags on basic labs, just silent risk building year after year. This video isn't about fear. It's about filling a gap your routine checkup leaves behind. In the next few minutes, you'll learn what homocysteine levels actually mean in real numbers, why normal ranges don't always mean low risk, who should absolutely test, even if they feel great, and simple, evidence-based steps that can lower levels safely. One of those steps is so straightforward that many people can start it tomorrow, without expensive treatments or complicated plans. Because prevention isn't paranoia, it's information. And in modern healthcare, what you don't test for can matter more than what you do. Let's break it down, calmly, clearly, and without medical drama, starting with what this test shows and why your annual physical probably missed it.